Euthanasia and assisted suicide is one of the major issues in healthcare, and it has been for decades. I remember reading journal articles about things like this when I was in medical school years ago, and I remember being so terrified. Other third parties making decisions about who's worthy to live and who's worthy to die, and these were just academic articles really back in my student days. But over the last few decades, I've seen more and more of a push for this, more and more openings in certain countries saying, well, we're going to limit it to this group of people, and they're going to be able to avail themselves of a good death, the euthanasia death. And now the slippery slope has really come to pass, because now we see this being applied much more widely across the board in so many places. And now here, even in the U.S., the discussion is more open. We should be able to do this. More states are starting to allow physicians to participate in these processes. And to me, it's very frightening, because I understand the concept of somebody being terminally ill, and everybody wants to die with dignity. That was always something that I thought about very seriously when I had a patient who was ill. Am I doing this to the patient or for them? Are there things we can really do to help this person, or are we just, unleashing our technology on them? Nobody wants to be in a position where they're so helpless and they're on machines or they're taking medications uselessly. But at the same time, taking your own life is a very serious step, because our lives don't belong to us. Our lives belong to God. And God doesn't want us to suffer. But, we live in a fallen, cursed world, and sometimes bad things happen. I think in a lot of cases, physicians could perhaps do a much better job of intervening in these situations, whether it's pain management or counseling with patients. But I've had several family members who ultimately died of cancer, for example. And it's very distressing to the individual and to the family. Nobody wants their loved ones to suffer. Nobody wants to suffer themselves. But when we get into situations where we have third parties who, by some arbitrary standard or criteria, say your life is no longer worth living, I think that's very frightening, because you may well feel like your life is worth living, and somebody else now has the ability to say, no, we're going to terminate you because you have an illness that we deem untreatable, or the resources we have to utilize to keep you alive is too much given your age or other circumstances. Where does that stop? Who sets the limit? Because we were promised limits decades ago, and we've seen that those limits have been greatly exceeded. So I have a great fear that this is going to be a much more severe, much more significant issue in the decade to come.